Now, look, next this morning, significant lockdown changes have come into place today. I'm sure you've well known. You can now meet up to a group of 6 in your garden or public park. Schools, markets and car showrooms are reopening. But in terms of the epidemic, where are we now and what do we want to happen next? Well, let's catch up with Dr. Duncan Robertson, who's been guiding us through this right since March from Loughborough University's School of Business and Economics. Duncan, morning.
Good morning, Ben. Hi.
OK, so where are we with the numbers?
Well, we're at the sort of level where the numbers have gone down. We've obviously gone over this peak, and then we're at the tail end of this peak. But I think what's slightly concerning is that the numbers aren't really, they're relatively steady at the moment. And so we're at this really critical stage. I think the Deputy Chief Medical Officer said it was a very dangerous stage about what's going to happen next. So, we can't really predict what's going to happen next, but there's a lot of risk around about what is going to happen as a result of these lockdown measures being released. So dangerous time.
We won't know, of course, for 2 or maybe 3 weeks. At that point, can lockdown be reasserted? What would the options be for the scientists and the politicians?
Well, I think these are options for the politicians, and I think what's quite clear is that the scientists are not being listened to quite as much as perhaps they were. But the problem is that if you look at the sort of graph or what's happened over the past, these infections go up really relatively quickly and then take a long time to go back down again. So if we do find that there are these exponential growth that we've been talking about, it goes up really quickly. It takes a long time to go back down. And of course, if you think what that graph means, it means people who are infected, but it also means people who are, ultimately dying from this disease. So this is why, and there's another thing, which is the sort of psychological effect of trying to re-establish these lockdown measures. So at the beginning of the epidemic, it was, we were all very scared,
yeah.
Rightly so. And I think what's happened now is because, there's talk about having barbecues and, everything seems back to as it was, but of course it isn't, and that's the really difficult thing. So if we do find there's a resurgence of the epidemic, it's going to be very difficult to establish the same levels of compliance with the lockdown that we have had.
So going from what you're saying then, actually the whole business about hygiene and social distancing now as lockdown eases is more important than it's ever been. Is that fair?
Yes, absolutely. So I think, we go, as you say, started coming on this program in March, and we're going back to really square one. When we're talking about washing hands and social distancing and making sure that we don't allow this virus to spread. And we do everything that we have in our own control to prevent that happening. So you mentioned things like barbecues you mentioned gatherings and the 6 people rule. So, just because we can do something doesn't necessarily mean we should. And of course, we all want to go and see our friends and, but be careful what you're doing. So don't mix with a group of 6 people, then in the afternoon another group of 6 people, and, the next day another group of 6 people. Try and keep it try and prevent, the virus, which you may have. We all may have this virus at the moment. Try and prevent it being infected to the people around you. So just think about what you're doing. And it's very difficult to do because we're seeing all these pictures of people in parks and, enjoying themselves. But just think of your own, all we can do is think about what we individually can do and just be very careful about what you're doing.
So paper plates and bring your own glasses.
Exactly, that's right.
Amongst other things, I mean.
Yeah, no, exactly, because, that's the way this virus spreads. It spreads through people breathing. So, this is where the whole 2-meter rule comes in. And there is, some evidence to say that if you're outside, then it's less dangerous than being inside. So, that's a good thing. But just think about, the crowds. As people get more and more crowded, the risk of it spreading is much higher. And as you say, the other way of it spreading is by people transmitting it on what are called fomites, which is basically, if you touch a plate or a door handle and then someone else touches that, then there's a risk of that being spread that way. Because, of course, people then touch their feet and it enters your body that way. So just think of infection control. Think about if you are hosting a barbecue, think about your responsibility to, prevent it from being spread. And this, as we've said for a long time, is a pretty virulent disease and is very infectious. So, just be careful out there.
I mean, I suspect that a lot of the behavioural scientists will be studying what happens over the next, a few days, weeks, and so on, very, very closely. I spoke to a friend of mine who lives in Norfolk just yesterday, actually, and she said up until now it's been really quiet. It's been much quieter on the roads and so on and so forth. But certainly near where she lives, she said over the weekend it had been really busy.
Well, exactly. And, I was looking at the latest, UK government guidance, and we're still in this COVID alert level 4, which is basically saying that there is high transmission in the community. And we've also, so we're getting all these sort of messages. And, if you go onto the Department of Health website, it says the risk to the UK is high. So, these messages aren't being communicated very well to the public, because, there's a lot of discussion and lots of news that comes out. And that's what's very difficult about following this as a scientist, is it's not just what's presented in the sort of academic publications and on the government websites. There are briefings that go out, and as a result, people's behaviour changes. So, if you announce something about barbecues are available on Monday, but if you announce that at the weekend, people think, I've heard the word barbecue, I'm going to go out. So absolutely, behavioural scientists are going to look back at this, and I'm sure lots of papers are going to be written about it. But it's very difficult to see what's going to happen because we're changing so many things at a time. For example, shielding and all that discussion. So it's very difficult to, if it was just schools reopening for primary schools, then that would be one thing. But there's a whole lot of things that are going on. So we're in this very dangerous time. And, if you speak to people who know about this, the Association of Directors of Public Health are basically saying we should be very slow in terms of releasing this lockdown. And they're basically saying we shouldn't do it. So there's a lot of political decisions that are being made. So it's not following the scientists or not following the consensus view.
It's interesting. I looked on the government website today, and again and again it says be alert. And I guess what they mean by that is, absolutely scrupulous hygiene and scrupulous social distancing. I suppose that's what you've been saying. Well,
I mean, it means something else to everybody. Be alert may mean something very different from, my family to someone else's family. So there's no real instruction there. Be alert, isn't really telling us much. Whereas stay home, that is telling us something. And, this messaging has been, it's less controlled, the messaging that's coming out as it was. So, but, as I say, go back to think about what you can do and just make sure that you aren't spreading the virus, because it's down to each of us to have our own responsibility for preventing it.
Duncan, it's good to talk to you. Let's talk again next week, but in the meantime, thank you.